Any patient of spine presents with pain, swelling, deformity, loss of function in the region of back. But there can be radiation along intercostal nerve and along the sciatic nerves, basically. Now, if there is pain, swelling, deformity, loss of function, this is the presentation of a spine case. And you have to begin with data collection. The data collection is identification and demographic data initially, followed by chief complaints asked by asking when were you completely alright and then what happened. And you chronologically note down the complaints. About each complaint, you say onset, course, duration, treatment taken, response, aggravating factors, relieving factors, associated factors. And about pain, you additionally ask site, character, intensity, radiation. By this part of the history, which is the history of present illness, you start thinking of a diagnosis and a differential diagnosis. Diagnosis being most probable, differential diagnosis being less probable, and that is site, nature, cause, effect, association. In this, the common problems, common diagnoses around the spine are congenital, which is spinal dysraphism. Then there can be scoliosis, which is because of hemivertebra, or something which is called as diastomatomylia. Then there can be a traumatic, where there can be a fracture or a dislocation with or without neurological involvement. Then there can be inflammatory, and inflammatory can be infective or immune. Immune is ankylosing spondylitis, infective is basically tuberculosis. Then there can be neoplastic, and neoplastic is usually benign is a eosinophilic granuloma, but malignant is a secondary or multiple myeloma. Then there is degenerative, and that is osteoarthritis of spine. Then there is metabolic. Metabolic is basically, say, osteomalacia first. Then you can say Paget's, and then there can be a paralytic involvement of spine causing scoliosis or muscle imbalance. So these are the conditions that you usually think of. You can add, detract or modify, but you have to do what is called as a rule in or rule out exercise to establish a diagnosis based on history or its differential diagnosis. Then you take past history of comorbidities, personal history and socio-economic history. Socio-economic history, and of course that is effect on the patient, effect of the disease on the patient, and the resilience of the patient, ability to fight back. That's what is socio-economic history. And it of course includes activities of daily living. Now, basically, the involvement of spine, pathogenesis is vertebra, spinal cord, and effects of spinal cord involvement including motor, sensory, autonomic, respiratory, abdomen, paralytic ileus, bladder, and source. And motor mein basically there is contractures or deformity or spasm. So you have to basically see or find out till what extent the spine has caused, spinal vertebral involvement has caused its effects. Alright? And this of course also affects function, mainly the locomotor function. Okay. Then you do a general examination, you do a systemic examination, and then you do a local examination. Local examination basically is deformity, loss of movement, localized tenderness, presence of cold abscess anywhere. Alright. And then neurological examination and effects of neurological deficit. Thermoregulation, respiratory, paralytic ileus, neurogenic bladder, contractures, and source, pressure source. Alright. After a thorough general examination and local examination on these lines. You make a diagnosis, you investigate, you put up a differential diagnosis, points in favor against, you put up a list of investigation which is to assess general condition, to establish cause, to establish effects, to establish diagnosis, that means site, nature. So these are the line of investigations that you have to think of and do, and then finally you plan treatment, which is basically to correct deformity, manage neurological deficit, evacuate cold lapses, treat cause, treat effect, and rehabilitate with residual disability. So this is the approach to a case of spine problem.